The following paid program is furnished by Raskin Resources Productions. It's for basic entertainment and informational purposes only and is solely responsible for its content. It does not necessarily reflect the views of Cumulus Media, its management, or its staff.
Welcome to the Patricia Raskin Show, the program that helps you turn obstacles into opportunities, challenges into solutions, and find answers to tough questions. The award-winning powerhouse voice of radio, Patricia Raskin. And now, here's your host, Patricia Raskin.
Well, hello, everyone, and we are back with our second hour of the Patricia Raskin Show. Very excited to be with you. And now we're going to talk about Medicare options for those of us who are baby boomers, and I'm one of them, will proudly say. And there are many of us, and many of us are listening, which is wonderful. We are with Nancy Mendizabel. She is the co-owner of Apple Valley Insurance, which is a trusted choice insurance agency in Rhode Island, which really strives to offer clients reliable and affordable quality insurance coverage. And today we're talking about an overview of Medicare options for individuals who are new to Medicare and the choices between which are happening now during open enrollment. And this program is brought to you by Apple Valley Insurance. So welcome, Nancy.
Thank you.
Yeah. So first, tell us about the open enrollment and what that means.
So each year
just a little closer to the mic. Good.
Each year between October 15th and December 7th, people that are Medicare beneficiaries have the opportunity to research different options and make changes for the coming calendar year. So it's similar to open enrollment when you were in the group world. So when you're working and you had that time of year when you could review your plans and options and switch it. So right now's the time to check out the different options between your Medicare Advantage plan maybe or prescription coverage, because every plans change each year, and it's really important to review the options that are out there, especially if the plan that you have right now does not meet your expectations. So if plans, if the plan you have is working great and you love it and there aren't any significant changes for the coming year, then, I tell people you can just stay as is and it automatically renews. Right. But if there's something that's not working, now's the time to check it out.
And what people need to know is that they're still paying for it out of their Social Security, correct? Because some people think, now I've turned 65, I'm not paying.
No, I like to tell people Medicare is not free. And we all think it's free health care, but it's not free. So everyone pays, and everybody pays your Part B out of your Social Security check. And if you're not collecting Social Security, you usually get a bill for that, like in 3-month increments.
And what I've learned is that you can certainly pay more out of pocket, which means many times your copays will be less. But it depends on how much you use it, correct? So if you're using physicians all the time, then it might be worth it.
Yes, to pay a premium, let's say, and have most of your copays covered. And when you become eligible for Medicare, or once you're in the Medicare recipient or beneficiary, you basically have 3 options. And you have, original Medicare with a prescription plan would be, one of the options. And you get your benefits primarily through, Medicare. So with Medicare, Part A is your hospital and Part B is your outpatient and doctor coverage. And there's deductibles that go along with each of that. And then you have a prescription coverage as well. And then the other 2 choices are a combination of premium and copays. And that's where you need to find the balance. So that's right for your situation.
All right. We have a caller, so I'd like to take our caller.
Okay.
Justin, your question or your comment? Hi.
My name is Justin.
Hi.
What's the topic?
I don't think we understand this. Okay. So, all right. So, Nancy, let's go back for a minute, and let's talk about Part A and Part B with Medicare. And also, folks, we're happy to take your calls at 438-WPRO, 438-9776, 800-321-9776. If you have Medicare and, this is now open enrollment and you're not sure, you don't know whether to change, you don't know what the changes are, give us a call. This is what Nancy does, and she can really help you. And, this can be kind of a helpful before you call her, so you really get to understand the lay of the land, because it can be confusing because it changes every year. Again, 438-WPRO, 438-9776. So Part A and B, the original Medicare, what that covers.
So when you have original Medicare, Part A covers your hospitalization coverage. So if you were in the hospital, there's a deductible associated with that. And it's for next year, it's going to be $1,288. And that's your deductible if you're in the hospital for whether it's 1 day or 20 days. It's a flat dollar amount. And then Part B, which you pay for, and you choose when you want to enroll for that, basically, either when you turn 65 or when you stop working and come off of your group. But that covers your doctors and your outpatient, and Medicare pays 80%, and then you pay 20%, or you're responsible for 20%. And then there's other, you can get a Medicare supplement to pick up those 20% copays or the hospital deductible, or you get a Medicare Advantage plan that puts those into specific dollar amounts for you in many situations.
Right. So it really, as we said in the beginning, it depends upon your health status, right?
Mm-hmm.
Because if you're going to use the plan a lot,
yes,
then it may be worth to get the extra supplement.
Yes. Yeah.
But if you're only going a few times a year, correct?
Yeah.
Then it may be just as good to be able to take the money from the Social Security,
Right.
which is where
Yeah.
where it's coming
a lot
from.
of times how I explain it to people is that under Medicare supplement, it's very suitable for people that like to have that are very budget conscious and like to have a monthly premium, and that also know that they're going to have they're going to use the benefits. They're going to have a lot of copays if they go on another type of plan. The Medicare Advantage is really good for people that don't want to pay for something they're not going to use. Generally healthy, might go to the doctor once or twice a year, and it's more of an a la carte system, so you pay a la carte.
Right. So you're going to pay more when you go to the doctor, but you're not using it as much.
Yes. Yeah.
So when you're eligible,
So usually, most people get their Part A the month they turn 65. So if your birthday's on Halloween, your Part B would start October 1st. So it's the first day of the month you turn 65. And Part A, there's no additional premium for that. There's no premium charge for Part A, and that's your hospitalization coverage. Then Part B, you can also activate that when you're 65 or when you're eligible based on maybe a special disability or something. You can activate your B, or you can activate your B when you stop working. And this year I've had a lot of questions from people about, if I turn 65 and I keep working, am I going to be penalized later on? And there's a lot of people that are under the assumption that if you don't sign up right when you're 65, that you'd be penalized. And that's not the case in most situations. As long as you stay on your group plan, then you sign up when you come off the group.
all right. Now we have a call. We have Dawn from Sterling, Connecticut. A Connecticut listener.
There we
Wonderful.
go.
Okay,
Hi, Dawn.
Dawn, go ahead. Your question for Nancy Mendizabel from Apple Valley Insurance.
Hi, thank
Hi.
you. I know I'm in Connecticut, so I don't know if this applies or if Medicare is the same everywhere. But
Go ahead.
my husband's disabled, and when he was accepted for the Social Security disability, we didn't take the Medicare for him at the time because we were on Medicaid
Okay.
with the state, and we got kicked off of Medicaid at the end of July, and I thought I could just put him on to Medicare, and they told us that he could not go on until open enrollment, which they told me was January through March, but then I keep hearing now through December. And then they told me his coverage wouldn't begin until July of next year, which I thought was crazy. And I'm like very confused by that.
So-
Okay.
Because it seems to me like you're saying the open enrollment is now, and I'm thinking that coverage might actually begin in 2017 in January.
Okay.
Yeah, so
Go ahead.
we're talking about two different things, because open enrollment right now is for people that already have their Part B and they're already
Okay.
receiving Medicare benefits. But
He's
if you
on
don't,
Medicare A.
he's on A. So to enroll in Part B, and this is more of something you need to probably go to the Social Security office and talk to them about. Maybe is if you don't sign up for Part B when you become eligible, either through SSDI or turning 65, then they do have a different enrollment period, and you sign up in January, February, or March, and it starts in July. So that is
Okay.
different from once you're already in the system and you're on a plan. So that's the Part B enrollment. And
All right, so that does make sense to you then, that even though he lost his coverage, he cannot get coverage immediately.
for the Part B coverage, that would be correct, yeah.
Okay.
And, my contact information is going to be available. Patricia's
Yeah,
going to have that. You could
let-
reach out to me individually if you'd like.
Do you handle Connecticut?
No, but I know someone that could help you in Connecticut, and also it's more of a general question because a lot of them each state has similar
Okay.
guidelines on that.
So, Dawn, let me give you the phone number. Okay? All right. Go ahead.
Okay.
Go ahead.
It's 401-949-0559.